I'm Dr. Mike Milligan. I'm here with Dr. Jonathan Parker. Jonathan is a charter member of the American Academy for Dental Sleep Medicine and one of the national experts and lecturers on dental snoring and sleep apnea dental therapy for that. Jonathan, thanks so much for being with us.
Thank you for having me.
Well, so I'm here at his initial course. You've got 3 courses in your curriculum, but your initial overview course for dentists
Yes.
of snoring and sleep apnea therapy.
Yes.
A fabulous course. I highly recommend you come to the beautiful Minneapolis, St. Paul and take this course. And but why would a dentist, Jonathan, want to go in and begin treatment of snoring and sleep apnea for patients?
Well, about 67% of adults snore, so it's a huge population, which means that 2/3 of the patients in their practice snore.
Right.
Could be an indication of sleep apnea, which is a significant health problem.
Yep.
Can impact, increases cardiovascular risk, can impact all areas of their health.
Right.
And so as dentists and practitioners who focus on the head and neck area, we are part of trying to help people manage their health.
Right.
And so we have a tremendous opportunity to help people identify this health problem and then help them along the path to getting it treated. Right. So it is, and it's an amazing area of, it's just so exciting and so enjoyable and so satisfying
rewarding,
to help people.
Right.
It's just tremendously rewarding.
Right.
So I think that it's an amazing area of dentistry that I think people should explore, right. And it's one of the fastest growing areas in dentistry.
Exactly. Yeah, absolutely. The Academy of Dental Sleep Medicine has grown, what, 20% a year for?
Yeah, 20% a year over the last 4 or 5 years.
Right.
Are now over 3,000 members,
right.
And the American Academy of Dental Sleep Medicine is a great organization, right. And it has moved this area of dentistry forward.
So fabulous. So yeah, a patient's options for treatment are CPAP, oral appliance, or surgery, or a combination of the above. And
right.
so there's a very important piece of the puzzle right there that dentists can serve.
Right. Dentists have, I think, a role to play, especially for patients that can't tolerate CPAP, because CPAP is the most effective therapy, but only about 50% of the patients can tolerate it. So the patients who aren't able to tolerate it, or patients with milder apnea or primary snoring, are great candidates to use oral appliances. And so it's a matter of really understanding this area of medicine and then beginning to learn how oral appliances fit and then how you can actually integrate it into your practice.
Exactly, and all that integration. You have a wonderful course here.
Thank you.
I've taken a number of courses. This is a fabulous course. You've got the resources are phenomenal that you sent us home with. The manual, the research articles, the kit with each burr that he uses in his office, every material, every lab that you use, all the things that you use. And then the third day of the course, it's a 2.5-day course, the whole third day is in your office watching you actually treat patients,
right.
Several.
Right.
So tell us about this course and what the dentist can expect and the curriculum you've put together. I know there are 2 additional courses, but this is the
right.
first one, and this is a great introduction to it.
Right. This is the comprehensive overview of dental sleep medicine. And what I've learned in teaching over the last 17 years is that dentists, or people in general, can learn through lectures and PowerPoint presentations, but it's challenging then to take that information and learn how to apply it in their practices. So what we do is we build a foundation of knowledge initially through interaction. It's small group, right. It's less than 10 dentists or less,
right.
And it allows...
And I think they always fill up, so this one did, the next 2 I know are, so go ahead and get signed up. He only does this a couple times a year, this comprehensive overview, so go ahead.
So what we do the first day and a half is we really review all of the pertinent information that we as dentists need to know related to sleep and breathing.
Right.
And then once we have that foundation and understand how it fits into our practices, we have a third day where we see patients together, where the dentists who attend actually get to learn how to apply the knowledge they've learned the first 2 days.
Right.
So when they go back to their practices, they can actually begin treating patients with some background in how to apply it. And it's been very powerful for the people that have attended the course in the past, and we continue to upgrade and update it each course based on what the feedback that we get from the dentists that are there, and looking at how the field is changing.
Right. I can tell you that the manual and everything that he gives is absolutely outstanding.
Thanks.
A very detailed individual here, Dr. Parker.
Thank
And
you.
then the clinical portion to actually, and this is the only course that I've been to that really has had this clinical, significant clinical part to it.
Mm-hmm.
And it's been wonderful to go in and visit with the patients, watch him work, watch his whole staff work, and actually, you know, ask questions as you do and see just what you do. And the small class size is part of why you're able to do that.
Right, right. The response has really been good, and it basically is the first step to starting to integrate this into practices, especially for general dentists and even the specialists that come.
Right.
Actually seeing it in action, yes, actually seeing it in action allows them to then begin to have a vision of what they can do in their own practice. And then we build on that in the other courses that we do.
Great. Now, are there any last things you'd like to say before we close this part?
Well, I think what's really driven me is that there are so many millions of people out there suffering with this problem that I really want to encourage dentists to start to get involved. We need you out there because the numbers of patients that are struggling with this is immense. And if you understand that only about 10 to 15% of people with sleep apnea have been diagnosed, it really is upon us to start to identify these people out there who are suffering, who don't even know that they have a problem like sleep apnea. And it is one of the most rewarding things I've ever done in my professional life or in my personal life, is to be in the presence of somebody whose life has shifted because we've been able to help them with treatment for their sleep apnea condition.
And we've got thousands of people coming to us already.
Yes, we do.
Every 6 months.
Yes, we do.
And it's just a couple of questions you can ask.
Exactly.
And identify many people who wouldn't even be identified or know of alternatives otherwise.
Exactly.
Yeah. So Jonathan, thank you so much for being with us.
Thank you, Mike. I appreciate it.
All righty.